nutrition, and my last tenure track position was with University of Maryland Extension, where my research and teaching was in stress, depression, and suicide among older adults and farmers. And then this position to open up, and in Kent County, we have an aging demographic population. And it's also in a rural community, so there wasn't a better tie-in that I found. I've also always wanted to live by the water, and so it just seemed like a perfect fit. So I was brought in as the health educator as part of the Rural Healthcare Transformation team with Dennis Welsh as the executive director and Laura Wilson as the director. And one of the initiatives that we have is the Aging and Wellness Center of Excellence. And so we're looking at providing services for the aging demographics. And so the programs that I'm putting on are directly related to our aging population in Kent County. So as a health educator, my job is to provide both resources and education to individuals to empower them to make positive behavior changes. So through my classes that I'm offering, a series online such as Healthy for Life, Mental Health First Aid, these classes allow people to learn information that then they can apply to their own day-to-day life. Due to COVID, all of our classes thus far have been virtual, but hoping to get out into the community soon. So I came in at the end of August in 2021, and then in January we launched our Healthy for Life. And that was a 10-part series that we then relaunched just a couple of months ago. And it is all about nutrition and healthy behavior changes. I've also had a number of classes in mental health first aid that have been online. So they can sign up going to our University of Maryland Shore Regional Health Chestertown website, and then they can enroll. All of my classes are offered for free, but registration is required. The first time that we offered Healthy for Life, it was a dialogue class. The second time that we offered it, we had 58 people register. And so having a virtual conversation with 58 people can be a bit difficult. So this time around, we haven't had it. I would say on average about 15 to 20 folks show up each week. You can enroll for one class or for the whole series of 10. I'm also offering a course in chronic disease self-management, and that's for people that are dealing with the challenge of a chronic disease. And that is a much smaller class, and it's a 6-week series or a 6-week program, and that is very conversational and participatory. All of the folks there help one another in understanding ways in which they can deal with their challenge of chronic disease. So it's really interesting that you ask that. So I always say you go in as a learner before you go in as a teacher. And one of the first things that I did was participate as the moderator of our community health needs assessment for University of Maryland Shore Regional Health. And the one thing that came out from that from doing the focus groups with community members was they needed more health education here in this area, and they needed more information on chronic diseases such as heart disease and cancer, and diabetes is a huge need within our community, as well as mental health information. So Healthy for Life, so my background is all about nutrition, and so Healthy for Life is based upon nutrition and nutrition changes that affect our overall health and well-being. So 2 programs that are unique to this area that we'll be offering next year. The first is Good Morning Farmer, and that's in collaboration with University of Maryland Extension, and the programs will be offered directly to our farming community. What makes us unique here in Kent County is we have a very large farming community, not only agriculturally, but on the water. So I just received a grant, and that money is going toward a program that we're calling Shore to Shore, where we're bringing health education and health screening to the watermen on the shore of Kent County. As I mentioned, I'm collaborating with University of Maryland Extension to bring the Good Morning Farmer program here to Kent County. I'm also collaborating with the Kent County Family YMCA and Washington College, where we're developing an internship program to bring students here for public health. Now, that's not clinical care, it's training the next generation of public health practitioners to create, implement, and assess public health programs that are preventative for the population. All of the classes that I offer are evidence-based, and so we have chronic disease self-management, and next year we'll also be offering a diabetes self-management class. Both of these are from Stanford University, as well as the Healthy for Life program that is through the American Heart Association and Sodexo. The Mental Health First Aid is a program that's taught nationally and actually was started in Australia. And this really meets the mental health crisis that we're undergoing. Much of it is due to COVID and the aftermath from that.